Hello, everyone. Thank you for joining me today. I will be presenting on hypertension and preeclampsia. This is an in-service for the San Bernardino County WIC staff. My name is Renee Garcia, and I am a dietetic intern through Cal Poly Pomona. So for today, we'll be discussing hypertension and preeclampsia. We'll go over risk factors, some signs and symptoms, complications if the disease goes untreated. I'll briefly discuss the local demographics of San Bernardino County as well as the prevalence of these diseases. I'll go over some treatments, including both medical care and lifestyle modifications, and then we'll be wrapping up with how WIC staff can make recommendations for WIC participants. So first, what is hypertension? Hypertension is the medical terminology used to describe high blood pressure, and we can see that it is abbreviated as a capital HTN. Blood pressure can be measured manually with a blood pressure cuff and stethoscope, or with an automatic blood pressure cuff. And I'll just give a brief description of what blood pressure is. It is abbreviated as BP. It is the force of the blood pushing against the inner walls of the arteries as it travels from the heart to the rest of the body. The blood pressure is recorded with two different numbers. The first number we can see is the systolic pressure, and that measures the pressure of the blood when the heart is contracting. The second measure is diastolic, and that would be measuring the blood pressure while the heart is relaxing. And we can see the example there. It shows us 120/80 millimeters of mercury. So that's kind of a standard blood pressure measure, and millimeters of mercury is the way that they describe the pressure. Here is a chart of the categories and stages of high blood pressure or hypertension. So we can see it's only elevated when we get to that 120 and less than 180, but where we have that official hypertension diagnosis, we can see at stage 1, where the systolic pressure is at least 130, or the diastolic blood pressure is at least 180. And then it just elevates from there as both and or pressures increase. So next, what is preeclampsia? Preeclampsia is a very serious blood pressure condition affecting pregnant women. It is often diagnosed at or after 20 weeks gestation. Moving along, we have risk factors for both conditions. We'll begin first with hypertension. So one of the major risk factors is age. So 55 and over, your risk increases, as well as if you have a family history of hypertension, you are more likely to have hypertension later in life. Smoking and tobacco use, as well as excessive alcohol use, is also associated with the higher risk. Overweight and obesity, lack of physical activity, and a high sodium intake. For preeclampsia, some of the risk factors include also a history of hypertension, kidney disease, or diabetes. It's common in first pregnancies or with multiple pregnancies, so if there's twins, triplets, or more. And again, if there is a family history, then it does increase risk. And we see overweight, obesity, as well as some autoimmune conditions. And next, we have signs and symptoms. Some of these are similar between the two, but preeclampsia does differ just a little bit. So with hypertension, we have high blood pressure readings, and that would be, you could refer to that chart that I showed previously. We have chest pain, some dizziness, edema, and edema is like a fluid accumulation or swelling, usually in the extremities, feet, legs, hands and arms, sometimes face. We have heart palpitations, decreased urination, seizures, severe headaches, and vision changes, which would include like blurry vision. For preeclampsia, we can see that we also have high blood pressure readings, but we also get headaches. And women with preeclampsia might suffer from blurry vision or excessive light sensitivity. They may exhibit upper right abdominal pain, which is associated with liver swelling and inflammation due to that high blood pressure. And then we'll also see edema, but with preeclampsia, it's generally in the ankles, hands, and face. And then another one of the markers for preeclampsia is finding high levels of protein in the urine. So if these two diseases are untreated, we do have some common complications. So starting first with untreated hypertension, we can have atrial fibrillation, which is also referred to as AFib. And this is just an irregular heartbeat. It's often too fast as well. Next, we've got chronic kidney disease, as well as dementia, coronary artery disease, peripheral artery disease, heart attack. We have hypertension retinopathy, which leads to vision loss, and stroke as well. And for untreated preeclampsia, we do have some similar complications. We have seizures, stroke, coma, kidney and or heart disease, organ damage, including the heart, kidneys, and liver, blood clotting disorder due to liver damage, placental abruption, that would be where the placenta pulls away from the uterus, and then maternal and or fetal death as well. Okay, so looking at our local area, I just wanted to quickly go over the ethnic demographics in San Bernardino County and then the prevalence of hypertension within San Bernardino County as compared to the rest of California. So when we're looking at the left, that pie chart represents the distribution of ethnicities within San Bernardino County. The largest population here is Latino, coming in at 54.2%. Next is white community at 25.4%. Then we have Asian community, 8.4%, Black African American community, 8.1%, multiracial, we have 3.1%, and then a very small percent, 0.4 of Native American and 0.3 of Pacific Islander. So moving on to the chart on the right now, this bar graph represents the prevalence of hypertension within San Bernardino County. That would be the blue bars, and then the orange bar is the prevalence within the entire state of California. So we can see the highest prevalence is in the Black African American communities within San Bernardino. That would be 46.6% as compared to California, which is 38.1% for the whole state. Next is white. That is 35.1% in San Bernardino County and 29% in California. And we can see it goes down a little bit from there, but generally we can see that there are higher rates within San Bernardino County for hypertension as opposed to the entirety of California. Okay, so some treatments. We'll start first with medical treatments for hypertension, and this would include two categories. On the left, we can see medical care, and then in the larger part of the page, we have medications. Medical care associated with treating hypertension involves regular doctor visits, and that would either be with your primary care physician or a cardiologist. Usually, the individual will be instructed to monitor their blood pressure at home regularly. A lot of insurances will cover the cost of a blood pressure monitor at home. And then the third is medication adherence. Medication may be necessary for many people to control high blood pressure. So we can see I've broken it down into 5 different types of medications. I don't want to spend too much time on this. I more just want to give you an idea because a lot of people are on these types of medications. So the most common types is diuretics. What diuretics do is they increase urine production, which then decreases total blood volume. So when blood volume is decreased, then the blood pressure generally goes down. 2 common medications for this are Lasix and aldactone. And then the other types of medications you see there generally act on some type of enzyme in the body. And what they do is they relax the blood vessels, and they are called vasodilators. So when the blood vessels are allowed to relax, the blood doesn't have to push through so hard to travel around the body. So that would bring the blood pressure down. And then there are the beta blockers, as we can see on that bottom left there. Those actually help slow down the heart rate, and that in turn can decrease blood pressure as well. Some medical treatments for preeclampsia. The medical approach to this is a bit different. So again, we have those frequent doctor visits, usually with the OBGYN, to monitor both the maternal and fetal health. It may be recommended if it's very severe to actually deliver the baby early, and that would be generally not recommended until the mother reaches at least 37 weeks gestation, just to make sure that the baby has matured as much as possible. It is recommended to have frequent lab follow-ups, and that includes ultrasounds to check on liver and kidney health, as well as urine and blood tests to track the protein amounts and other biomarkers as well. These pregnant women with preeclampsia are also encouraged to monitor their blood pressure regularly at home. If insurance doesn't cover these monitors, there are clinics and even pharmacies where you can go, and there's machines that you can just use there also. In very severe cases, the mother may be recommended for inpatient monitoring, where she would stay in the hospital and receive constant monitoring and interventions if necessary. And then there are some antihypertensive medications that I just showed you on that previous page that are safe during pregnancy. 2 of those are labetalol and nifedipine. And finally, the most common way to cure preeclampsia is by delivering the baby. Generally, when the mother delivers the baby, the preeclampsia with the high blood pressure and the other symptoms usually resolve. Okay, and coming to lifestyle modifications now. So lifestyle modifications generally includes things that are not medically related. So here we can see for hypertension, focusing on maintaining a healthy weight helps reduce the risk of developing the disease and helps reduce the severity of the disease if one has already been diagnosed with it. Following a heart-healthy diet, such as DASH or Mediterranean diet, is recommended. In some cases, individuals are encouraged to reduce their sodium intake. Some recommendations say that less than or equal to 1,500 milligrams of sodium per day is best, but to focus really in the beginning on getting 2,300 milligrams or less per day. Increasing one's daily physical activity is recommended, as well as cessation of smoking or tobacco use and alcohol use. Okay, and now I'm going to talk about the 2 diets that are most commonly recommended for hypertension and preeclampsia, the first of which will be the Mediterranean diet. I have 2 different visuals here representing the same diet. The one on the left is just kind of more simple to look at. So it talks about the foods that we should eat every day, which would be those fresh fruits and veggies and whole grains, as well as olive oil, healthy fats, things like olive oil and avocado. Things that we should eat a few times a week at least would include fatty fish like salmon, and then we have nuts, seeds, and legumes. Moving on to things that maybe we should just have about once a day, and that would be low-fat, non-fat dairy, eggs, and poultry. And then we can see those foods on the bottom that we should limit to once per week or just try to avoid if possible, including red meats, sweets, processed foods, things like that. The chart on the right is more of a food pyramid situation. I like this one because it shows on the bottom that we should be drinking an adequate amount of water, that's very important, but it also has the inclusion of physical activity as well. So this one's similar. It does talk about the servings, what we should have every day with every meal, what we should limit to once a week or 2 to 3 times a week also. Okay, and the second diet is the DASH diet. This stands for Dietary Approaches to Stop Hypertension. It is very similar to the Mediterranean diet, but of note, they add on also a sodium restriction. And I put that important note at the bottom that though this diet in general is safe for pregnancy, it's not recommended that pregnant women limit their sodium intake. That would be something that they should discuss with the doctor. But generally, this has similar eating pattern. I like this one because it separates it and says these are good to eat, and the foods on the right should be limited. So again, we have that same kind of food groups: fruits, veggies, whole grains, fat-free, low-fat dairy, fish, poultry, beans, nuts, and seeds, and then those oils. And then things to avoid on the right or limit would be those fatty meats, red meat, full-fat dairy. We have those sugary drinks, sweets, processed foods, and sodium. And then that table on the right gives serving recommendations per day and then per week as well. So those 2 diets look a little bit complicated. I'm aware that when working with WIC participants, it may not be possible to take that much time to go over those diets in detail. So I just kind of highlighted things here by category of things that are important. So first, I'm focusing on things having to do with diet. Fiber is super important. I'm going to start there. Fiber is not only good for hypertension, but it's great for so many different health conditions, such as maintaining a healthy cholesterol level as well. So when we're talking to our participants about fiber, we can really emphasize fruits and veggies and whole grains and legumes and things like that. The goal is at least 25 grams of fiber per day, but what we can really talk to the participants about is just including fruits and veggies and whole grains every day. Moving on to that center column there, we have sodium or salt. It's recommended that we consume 2,300 milligrams or less per day. If the participant is not pregnant, it's generally safe to recommend a lower sodium diet if they do have hypertension. And that can be seen on a lot of packaging now. It can say low sodium or lower in sodium. We can encourage them to find seasonings or use herbs and spices that don't have added sodium. Citrus is always a great recommendation for cooking as well. And then on the right, we can see healthy fats. So olive and avocado oils are great for cooking with. Fatty fish like salmon, and then we can see that some healthy fats come from nuts and seeds as well. When looking at a nutrition label, it is helpful to talk to participants about choosing foods that have less than 5% of the calories coming from saturated fat. That can get a little complicated. You may need a whole separate nutrition education appointment to go over nutrition labels, because those can be complicated and scary for people sometimes. And lastly, the final recommendation we can give to our participants is to talk about adding daily physical activity. So I just put the little table or chart here that came from the Health and Human Services Department, and this again encourages the 150 minutes per week of moderate activity or 75 minutes a week of vigorous activity, depending on the type of physical activity that the participant enjoys. And they've also shown that including strength training 2 days a week, so lifting weights and things like that, is also very, very beneficial for overall health. Lastly, here are my references. And thank you so much. I appreciate you listening to my presentation. I hope you have a wonderful day.